Welcome to Habitual Excellence presented by Value Capture. This podcast and our company helps you and your team achieve habitual excellence and get better every day by focusing on one clear goal, one set of values, and one way of working. In simple terms, we want to help you create more value by providing the best care and the safest environment for both patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
Welcome, listeners and watchers, to the Habitual Excellence podcast. I know I say I'm excited about everyone, and this one is no exception. This one is a very special one to me, in part because we get to talk with Geoff Webster, who is not only my partner in crime professionally for almost 30 years now, going back to the co-founding together with Paul O'Neill Jr. of Value Capture itself, but even before that into our predecessor work, which Geoff may allude to, and someone who has always been there for me personally and professionally in a way that's really made a difference, and someone I've learned from tremendously, as many of you have and will. So, Geoff, welcome to the program.
Thank you, and completely mutual, Ken. Looking forward to it.
We're really glad to have you, and we're really excited to talk about the topic of the work you and many partners have been doing to move upstream from health, from the health system as it's structured or not structured now, to do some dramatic things using the principles to preserve health, and doing it through a vehicle that is very exciting itself called Pittsburgh Futures. And we'll get into all of that. But before that, I gave people an overview of our connection, but will you introduce yourself, tell a little bit about your career and your path to this work?
Sure, absolutely. So, first of all, my background is in public administration and public health. So, going all the way back, public health has been a fundamental element of sort of how I think about the world. I was incredibly fortunate way back in the early 90s, really dating myself now, to work with Bob Ross at the Philadelphia Department of Health, and then Bruce Segel at the New Jersey Department of Health, and a great team there. And then in our work with hospitals at VHA of New Jersey, Kurt Lindberg and Nancy Altimus, who really exposed me to all kinds of strains of thought and experiences, including our work with hospitals with Don Berwick and Tom Nolan and others, where at that time already people were thinking a lot about the social determinants of health, and a lot of the futuristic thought was about, well, when will hospitals go away? When will we need many, 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 many fewer beds because we actually are doing the right things upstream to keep people from ever getting sick. And of course, that vision has not yet materialized, but it is still the right vision. And so the question really becomes, why haven't we gotten there? And, when I moved back to Pittsburgh in 1996 and joined the Jewish Healthcare Foundation and you and Karen Feinstein, and had this dual role with the Consumer Health Coalition and the Pittsburgh Regional Healthcare Initiative for a while. On the one end, I'm seeing all these families who just have very basic direct needs for preventive health care, for food, for shelter, and all kinds of other things. And we're trying to meet those needs on the one end. And then we're working with health systems that are extremely well intended and extremely good at meeting the back end needs that people have after they're sick, but completely mal-designed for meeting those front end needs, or even thinking about how to go about doing that in very effective ways. So from the very beginning, there's been that struggle of how do we take the outside, the things that aren't even considered healthcare, but they are, and build them in. And I remember in particular when Paul Sr. Introduced us to Mr. Oba at
Paul O'Neill Sr., yeah.
Yes. And Mr. Oba was one of the leaders of the Toyota Supplier Support Center, and taught us, so much about how to use ideal state thinking and systems principles to drive excellence within health systems. But one of the questions that he came back to us with was, what would a system that creates health look like? And I remember all of us going off and scrambling and doing our drawings and trying to think about what that would look like. And many of them included things that were trying to be upstream of the healthcare system. But even at that time, as much as we were being inspired and trying to think about things in a different way, um, all of us were, and I think continue to be trapped by the current weight of the framework that there is for what healthcare is. And we define our healthcare system as this thing, which really means hospitals and a bunch of ambulatory centers. And that's not where the majority of real health is bred. It's really comes from things like food and shelter and mental health and stress and wealth, income that it maintains you, and all of those things are what create health. And then the health system just reacts to the back end when those things aren't true. So a lot of where Futures comes from is trying to think about how would we create a region where everyone thrives? And to do that, you have to think way up. I mean, it's not even about healthcare per se, but health is an outcome of everyone thriving, just like wealth is an outcome of everyone thriving, or safety is an outcome of everyone thriving, and education are outcomes of people thriving. So we try to really think about the common roots that enable people to thrive. And if we work on the common roots, we will create health and wealth and safety and education and all of these other things. And the only other real influence that I want to mention here is I had the great privilege of going to work at San Mateo Health System for a number of years. And that was where a lot of this really coalesced. Louise Rogers, who was their leader, real visionary, looked at San Mateo County, which is one of the counties with the highest life expectancies in the entire country, and in many ways a model of public health. But when you looked at San Mateo County, Black people in East Palo Alto had a life expectancy 19 years lower than the rest of the population of the county. And her aim was to help create a health system that could enable that to change. And over time, it has changed somewhat, not nearly enough. But I think we did some really unique things there, including these death reviews, where we would look at try to understand the root causes of deaths of people who had particularly complex connections to the health system. They had connected with, aging and adult services and conservancy and behavioral health and children and family health and the emergency room at the health center, and so on and so on. So people who had touched multiple parts of the health system. And when we started doing the deep dives into what caused this person to die when they were touching multiple parts of our health system, over and over again, things like they had experienced a childhood trauma which hadn't gotten resolved, which led to mental health and addictions issues, which were treated in silos and not treated together as one sort of holistic human experience with that person and their family, but as separate, treatment plans. Many of the folks that they were treating had as many as 5 case managers, and the average was 3. So the siloing of the system itself sets people up for not getting a holistic experience. So a lot of what we're trying to do at Futures is figure out how as a region to break down those silos so that it's possible to meet needs one by one in a much more holistic way that rolls upstream into so many benefits as a region. So we'll dive in there next. But
what an introduction. And I think all the listeners hear, uh, what you've gained from your mentors, the depth of the systems thinking that you have always had as you came into our work to help the health system be better, but always looking upstream and how do we get there? And these formative experiences, which I think many of us can certainly relate to, but also listeners hear your passion, your expertise, your commitment. And so you've sketched out sort of the frame for Pittsburgh Futures, but then at some point, you, Paul O'Neill Jr., others decided to make it concrete. Can you talk about sort of that story of founding Pittsburgh Futures, a little bit more about what it is, and tell us some stories about the early work?
Absolutely. So really, Futures origins um, um, date back to 2020. So the pandemic had started. Paul O'Neill Sr. had recently passed away, and Paul Jr. and I were having a series of conversations about, how can we speed things up? What's next? How can we take things to the next level? And Paul, a lot of that came out of, Paul really walking his local neighborhood, which is a fairly affluent neighborhood, but he's looking at house after house after house and saying, every house has needs. I know these people, right? Some people have food needs, some people have domestic violence needs, some have, regardless of what the needs are, humans have needs. And we don't always see them, but they're there. And our systems are not set up to address them. And, we were also thinking about this question of the region and how could we create, there's a power to localness and there's a power to the interconnectedness of people across the communities. And so we were thinking about a lot about how to tap into that. So as we usually do, we turned to the smartest and most talented people that we knew. And in this case, it was Christina Dixon and Heidi Norman. And they had led a lot of work in using these same ideas to think about how to redesign and actually produce results in redesigning education and social services at the Women's Center and at the city and in operations at the city and some prior work that Heidi and I had done with the Peduto administration.
CDO.
And so we really started to coalesce around this vision of, what if we could enable the leaders in the Pittsburgh area to agree on a vision that was about creating the first region in the world where every single individual could grow to their fullest potential and thrive. Why couldn't we do that? Because we believe that that all of the resources and talent and knowledge and everything that's needed to do that already exist. They're just being wasted, and not out of intention, but for all the same siloing reasons that I talked about with San Mateo. We have thousands and thousands of just wonderful organizations filled with wonderful people meeting human needs on a daily basis. But they are doing it disconnected from each other, often competing with each other, with resources that seem constrained, but they're really constrained because of the amount of waste that goes into the way that work happens, just like we've seen in healthcare organizations. And we know how to work with leaders to create systems that make it possible to do much, much more with much, much less, much easier for the workforce by tapping the ingenuity of the workforce, which creates respect and dignity and all of those things in and of themselves, and creates more people who are more actualized themselves in the work. So all of this is a virtuous cycle when you do it right, but that takes leadership. And we looked around and we said, well, what leaders do we have, or what leaders can we expect to have? And the timing was just right because we were about to have elections for our mayor. We were about to have, in a couple of years, elections for our new county executive. We knew that the leadership was turning over at some of the health systems, and there might be opportunities to work there. And we knew that there was likely to be turnover in the Pittsburgh Public School District and the leadership. And so it created this opportunity rather than trying to convert people who already had decades of leadership, maybe not leading in ways that create habitual excellence, to try to develop leaders who could create habitual excellence. And in those and many, many other organizations. So that's why we created Pittsburgh Futures. And we really work not to do the work ourselves, but to advise the leaders of organizations to do work in ways that create habitual excellence in their organizations. And then we also see this opportunity to create tables where leaders get together on agreed upon goals. And this is an agreed upon way to achieve those goals and work across their silos to achieve results that any individual organization could not do. So we can dive into some of those examples, but
Yeah, no,
what
absolutely.
we're
And I'm
here
sure
for.
everybody's heard the power of the idea that's hard to resist, and the sort of root cause thinking about what gets in the way of actualizing what's already known that we can do, so that this vision of everybody thriving can be true. And then the savvy thinking about leaders and where to get them and how. But let's now take it to that concrete. So what happened? Who did you start working with? What were some of the early um, foci, and what happened?
Yeah. Well, we are realists and we're opportunists. So we focus on where are there leaders who are interested in growing and learning and working with us to lead in ways that produce excellent results. And the first person to poll was Mayor Gainey. He won his election in 2019, took off, or 2022, he took office. Um, and and no matter who the mayor is a necessary partner in this work, because if you don't have the mayor, you don't have the county exec, you don't have the Pittsburgh Public School Superintendent, you're leaving out great organizations that have the opportunity to do incredible things for people. So we were really excited to be able to work with the mayor. Um, he's been an excellent partner who really took the O'Neill Senior playbook and ran with it. And the O'Neill Senior playbook starts with, let's make our own workforce safe, and let's make all of our residents safe. So that was a mantra from the very beginning. And what we've achieved in those regards has been remarkable. The city of Pittsburgh is down well more than 20% across the whole city workforce in incidents that cause enough harm to their workers that they need medical attention. And over the first 2 years of that work, we were already at more than $10 million reduction in workers' compensation costs. Not as the target. That's not why we were doing it. We were doing it to not hurt the workforce, but it's a result, because when you don't hurt the workforce, you don't have to pay their medical bills. So it's a perfect example of upstream thinking, and there are dozens and dozens and dozens. Actually, there are 1,400 events in the safety system right now in the city of Pittsburgh that have been reported and worked on to try to get to root cause. Like in many organizations, it's actually a small fraction that really you get to root cause and prevent it from happening anywhere else. But it doesn't take 100%. It takes a very
Yeah.
tiny percent to produce
Yeah.
those kind of results. And my favorite example is from the Department of Public Works, where Chris Hornstein has led some amazing work to drive this kind of work. And it was a snowy day, and there's a snow truck a plow driving around town, trying to keep the roads clear, and it itself slips and hits a guardrail. And no one was hurt, but it's called out. And the first instinct is, well, why did this happen? Well, it was icy. Well, yeah, so there's nothing we can do about it being icy. In Pittsburgh, it's going to be icy sometimes. So that was it. And Chris looks at this and he says to himself, I don't think that that's the root cause. So let's dive a little deeper. Can we go see where this happened with the
Yeah.
people who experienced this? When they get to the spot, it's icy because there's water on the road. Well, why is there water on the road? Well, there's water on the road because there's a culvert under the road that is blocked. And so the water's pooling and coming up on the road. Well, why is the water pooling? The water's pooling because there's overgrowth of all kinds of vegetation. Why is there overgrowth of all kinds of vegetation? There's no standard whatsoever for clearing vegetation out of culverts to keep them from getting blocked, to keep the water from going on the road. So, um, so of course they first get the ice off the road, and then they have to
Right.
wait for the ice to thaw enough to take the vegetation out. But they do it there, and so that's great. But then they ask the question, well, where else do these conditions exist? And guess what? There are 78 places in the city of Pittsburgh where there were culverts that were overgrown enough to have water up on the road that could. So, from this one event, doing
Mhm.
real root cause problem solving, where you go and you see and you're with the people who do the work and you ask whys enough to actually understand what's going on, they found 78 places where they could clear the vegetation, and they created the standard that keeps that from happening again. So this isn't one truck in one place.
Yeah.
This is prevention of possibly hundreds of accidents over years, where not only city trucks, but also just drivers and residents of the city of Pittsburgh could get harmed. And there are, as I said, thousands of those examples. So this
Right.
habitual excellence is not about a program or a particular project. It's about creating those eyes to see and the people who do the work, calling out thousands of problems every day, solving them to root cause, and creating better conditions for people. So that's
And
just
designing
one
what perfect would
example.
look like. Yeah, and using these tools to design what perfect would look like. So
Yeah.
that is one example. And those of you that have in the audience that have worked with us on the principles of habitual excellence through value capture, Pittsburgh Futures, or other sister allied groups will be excited to hear that example and the results tied to it. Geoff, can you sort of talk about some of the other things? As you said, it's not a project, it's not a program, it's a way of thinking and leading and doing, and it spreads virtuously. So can you talk about some of that spread into other areas and tell us some more stories?
Absolutely. So a couple more stories. Well, one is we just recently did an employee recognition event. And first of all, there had not been this kind of employee recognition event, as far as we know, in the history of the city of Pittsburgh. There are many, many people who have worked at the city for 30 and 40 years and have never been recognized for their work to make the city better. So that in and of itself is something really important. But at the event, there were between 150 and 200 people, all of whom had been nominated by people within their departments because they had taken these ideas and run with them in 100 different ways. So, so again, back to this isn't about a program, or
Yeah.
it's about a system that enables people. But let me get into a couple of the places where we did do deeper dives, because not all of it is about one by one problem solving.
Right, right.
Um, and we did, there are a few that are really noteworthy. One is the city has signed on to the idea of Vision Zero for traffic safety, which, many leaders don't have the courage to aim for zero because they're afraid they're going to get dinged if they don't hit it. But aiming for zero is a necessary thing in
Right.
order to really unleash habitual excellence. And so far, the city is down about 31% in serious traffic events over the past, I think, 4 years. And that work needs to continue. And that's really about creating infrastructure that that makes it so that it's not all about behaviors. It's about creating the infrastructure so that it's very hard to behave in the wrong ways, right? Which is critically important. We've also done things like create walkable neighborhoods, 4 miles of walkable neighborhoods. There was no system possible to make a walkable neighborhood because people own their own sidewalks. So the only thing you could do was cite them until they fix their sidewalk. And of course, some people don't have the money to do it, and other people don't feel legally bound, so they just don't do it. Um, Basically created a system of cost sharing and having the city do the work so that you don't have to deal with contractors and all those kinds of things. And that has enabled miles and miles of sidewalks, including around schools like Arlington, where they've seen reductions in chronic absenteeism because people can safely get to school now in ways that they couldn't before that work. So that's how these kinds of systems are interconnected. But the most impressive work, I would say, and the stuff that I think at least I'm proudest of, is the violence elimination work. So from the very beginning, the idea that we really shouldn't have any murders or non-fatal gunshots in the city of Pittsburgh. It's just not an acceptable condition to say that we're going to have those things. And of course, a lot of people say, well, that's impossible. You can't do that. People are going to be violent. Well, throughout the city, uh, more of a public health approach has taken hold. And while the country as a whole has seen really substantial reductions in violence just as a result of coming out of the pandemic, the country is running at about 25% reductions in violent incidents. The city is running at 52% as of this morning in violent incidents. And in one particular neighborhood, the Southside Hilltop, with the incredible leadership of people like Chrisera Johnson, who is the Stop the Violence coordinator up there, and a team of people from the community who invented a system to understand who's at the fork right before they're going to be go a violent path or a non-violent path. Who's at high risk or moderate risk of going one of those routes. Let's figure out a way to find people who are in that situation and treat them with humanity. Figure out what the problems are in their lives that create those conditions, and then literally handhold through the process with support and trust and an adult relationship that can solve those kinds of problems related to housing or addictions or mental health or trauma or anything else, and be able to mass customize using the systems principles that we teach. And in that neighborhood, we are now at 91% reduction in homicides. As of the peak of the pandemic, there at this time of the year, there have been 11 homicides in that neighborhood. This year, there has been one. And in terms of non-fatal gunshots, at the peak of the pandemic, we were at 20 non-fatal gunshots in that neighborhood. And as of this morning, there have been 4 this year, which is about an 80% reduction. So to people who say it's not possible, It is possible, but it takes really intelligent system design. It takes engagement of the people who know that work and do that work. Um, and most of all, it takes truly treating everybody with dignity and respect. Um, and that's fundamentally what this work is about. So it's incredibly valuable work. And one of the team members, Kiana, who's just absolutely wonderful, had a quote that during our work, which was, if we pull this off, we're not just changing violence in Pittsburgh, we're changing Pittsburgh. And that is the truth. We've changed that part of the city, and we're going to continue with the support. We can continue to want to work with the next mayor and continue this work and spread it to the county and PPS and elsewhere. So just incredibly exciting.
Amazing and amazing, powerful. Couldn't add a word to add to the power of what you're describing. Um, Geoff, you started to say what's next, and so people won't be surprised it's extending some of the same thinking, and you just started to hint about other partners. And knowing, you put together an extraordinary organization whose mission is to help draw other organizations and entities together. Say a little bit more about this key strategic moment
Yeah.
for
So
Pittsburgh Futures and what's ahead.
So the future is incredibly bright in many, many ways. There's obviously a lot of countervailing forces in the world, but that's why futures is all the more needed. We have an incredible partnership going with Pittsburgh Water, where Will
Yeah.
Pickering is leading a similar kind of initiative where already they have 42% reductions in worker safety events within the workforce of Pittsburgh Water in just the first 5 months of them having a
Mm.
system like this. And they're working on critically important things like lead line removal and speeding it up and working on their valve systems so that they have safer water for everybody, things like that. Just incredibly important. But what's next is how do we take these partnerships that are with a handful of organizations and get even broader? So a great example of that is actually think about the work with the city and Pittsburgh Water, and then think about things like a one dig idea. So right
Mhm.
now, around the city of Pittsburgh, the city paves roads and they dig up roads when they need maintenance. The Pittsburgh Water digs up roads and then they put them back. The gas companies dig up roads and put them back. Cable, so on, so on, so on, right? Roads often get there isn't coordination. So people uh, dig up the roads and then they put them back, and then someone else digs up the road and puts it back.
I
Um,
am a witness to the truth of this
yeah.
statement.
Now, of course, any rational person looking at this from a regional perspective would say, why do we do this? And the reason we do this is we have silos with their individual needs and systems and
Yeah.
all that stuff, but they don't work together. Um, so imagine a world where instead of doing that, we actually had a table where we get the people who do this work together and we say, there's obviously unplanned work that you don't know about, but the vast majority of the work is planned. So how can we plan out our work and how can we align it so that the miles and miles and miles of roads that we dig up in a given year, we dig up together. We do all the things that are needed to bring that infrastructure up to the top level, including putting in conduits so that we can do future high-speed networks and all kinds of things that, we may not have funding or capability to do now, but we could. And let's not only do that, but let's take the savings from digging and digging and digging and digging and put it into putting the roads not back the way they are, but the way we know they should be. So Vision Zero and Complete Streets has already designed what the streets of the city of Pittsburgh and other places should look like. when we put them back, let's take the savings and put them back so that they're safer, so that we can also achieve things like Vision Zero, for traffic and pedestrian and bike safety. Um, and it's that kind of, I think, visionary thinking that if we use it across our parts and we have all of our leaders engaged in deploying the resources they have in intelligent ways, we could have a fundamentally different region in 20 years. But if we don't do those things, all of the sunk cost of the things that we're doing now become waste because we're going and digging again, right? And not doing the things that we need to keep people safe. And that is public health. When you do those things right, you have safe water, you have safer air, you have safer streets, you have less violence and cleaner communities, and that is public health. So that's part of our vision.
Oh, it's great, Geoff. And it's public health and it's leadership. And again, you've been so clear about pointing to the way of thinking and the systems design and the basic framework that leaders have to have, rooted in respect for people, but also putting together intelligent systems across silos to solve these problems, and that the resources are there, and that to create greatness from. And today they're being lost and wasted in ways that frustrate everybody and frustrate the results that leaders ultimately really want. So it's so exciting, and it's so exciting to hear your passion. Um, what what do
Let me
you
dive
think?
into one more
Yeah, go
example
ahead.
before you.
Yeah. One
So
more example. Okay, great.
one more example, because the violence learning line has created a space where we have learned how to identify people who have needs and meet those needs.
Right.
And the same needs that would cause some people into a space of violence just lead other people into a space of not having the space to be educated,
Right.
or the space of uh, being unhealthy in ways that relate to their mental health or their diet or their drug use and addictions, right? So, the other huge piece of this vision, and this is where I think a partnership with the city and the county and the school districts and all these other partners come in, is it would be possible for us in this day and age to understand the needs of basically every individual and every family,
Yeah.
and amongst us create systems like we've done with the violence learning line that essentially meet every person and family's needs with many fewer resources than we already use. So that to me is the ultimate challenge. Because if we can do that, whether we use the lens of violence or health or safety or any other lens you want to use, if we can help find and support people and families to thrive,
Yeah.
everything else, that's the root cause. If we work on that, and meet the needs that people have for their fundamentals, just Maslow's hierarchy of need, um, at the most fundamental levels, so that people are getting closer and closer to that sort of self-actualization and growth, we can do anything as a region. So that's, I think, our ultimate vision, and we believe we're closer than ever to being there, by our existence, but also by the incredible partners that exist around the region to tap to make that true.
Amazing. Um, Geoff, what do you think some of the key lessons you've gleaned from doing this work? You've always had a powerful vision related to this. You've worked with health system leaders that want to go this direction. You've now done this visionary work. What have you learned about leadership yourself as a leader and observing other leaders during this Pittsburgh Futures experience that you think bears underlining, um, for other leaders who, have a challenging seats, but seats of great privilege?
Yeah, absolutely. So, we've learned a ton from a lot of people, obviously, around the whole country. Um, One place that I think we've gone and seen a couple times is Cincinnati,
Yep.
where the All Children Thrive Network, with the great leadership of Uma Kodagal and Rob Kahn and folks like that, um, have taught us a lot about community engagement, built from the community,
Yeah.
and about using the power of using improvement principles and teaching people the improvement principles and enabling growth of those principles across organizations. So we've learned a ton from them. And I think they continue to learn from us in terms
Mhm.
of using habitual excellence principles and aiming for zero and the role of leadership, a lot of different things. So that's been a great partnership and learning. And I've in particular been in kind of a mutual coaching relationship with Laura Mitchell, who used to be the leader of the schools in the superintendent of schools in Cincinnati, where they drove third grade reading, uh, just incredible improvements in third grade reading, including reductions in the racial gap
Mm.
in performance in the schools. So much to the degree that their school district was like ours, shrinking, and they were closing schools. And within 5 years, they were buying back schools because the Cincinnati public
People
schools were
wanted
the
to be
place
there.
people
Yeah.
wanted to go rather than not.
Yeah.
So there's huge lessons there that we can
Great.
learn as a city. If I were to say one thing that is really important that I've learned and continue to learn is you have to put yourself in uncomfortable spaces every day to challenge yourself to grow. And if you find yourself avoiding the uncomfortable spaces, um, you're not leading. So for me, that has meant, in many cases, just like I challenge leaders all the time. I think one of the values that Futures can bring to the table, it's not just me, but our whole team, and many others who've played the role with our team, like Gerald Harris and Lisa Beckwith and
Yeah.
some of the value capture team that has been critically involved in much of this work. Um, the value we bring is a lot of leaders don't get challenged. They don't want to be challenged, and so they put themselves in a space with people around them who will not challenge them. You will not be a great leader that way. So, and the same is true for me and for everyone else. If you don't put yourself in a space where you're challenged, you will not grow, and growth is everything. So, I would just say that's a key lesson for me and a key lesson that I continue to see and learn with all of the leaders that I work with. Um, if you put yourself in a stagnant space, you'll stay stagnant and you'll never improve.
Pretty profound. Pretty profound. I know found myself scribbling down some of these wise words, and I'm sure listeners are as well. Um, Geoff, I'm also sure listeners are going to want to learn how they can learn more. So, what are the best ways that people can tap into Pittsburgh Futures, the framework, the thinking, knowledge about it? Where can they find more information and connection?
Absolutely. So our website is pghfutures.org. So you can always go to our website and find a variety of case studies and about us and sort of learn more and contact us. We also have a Substack newsletter called A More Perfect Region that you can subscribe to. And that's a great way to keep track of the various things that we're learning and are going on in the region through our work. Um, and then we have a LinkedIn account as well, Pittsburgh Futures Collaborative. If you search it on LinkedIn, you can get connected there. And of course, always you can reach out to me at gwebster at pghfutures.org.
Amazing. And listeners, and if you want to get more experience with the principles of habitual excellence, the Value Capture website, valuecapturellc.com, and all of our rating, and make sure to like and follow this podcast, Habitual Excellence, wherever you get your good, deep leadership lessons here. Geoff, I know I've been inspired by my whole career working with you. This hour is no exception, watching what you've done with real courage in Pittsburgh Futures has been inspiring and deeply hope-giving. And I know it will others who listen to this. So thank you so much for being a guest.
It is quite mutual. And I forgot to mention, Ken, your insights at the beginning of Pittsburgh Futures are critically important as well. So thank you for all that you've contributed to all of our work together, but Pittsburgh Futures as well.
We have catchball all the time. And, I think value capture, where you still have a hand in, and, we're could not be more excited about the, in a way, sister organization work that you and Paul have driven together with your colleagues. So we're just excited, and I think the healthcare leaders listening, I hope, are really thinking about those upstream lessons, which I have to say diverge a little bit from some of the sort of standard talking points about moving upstream, and they have a gravity and a reality to the way you're putting it and framing it around leadership and the results you're creating that I hope will give people energy, insight, and and move more folks to action, because you're showing it's possible together with your partners. So thank you, Geoff. Thanks for being here.
Thank you.
Thanks for listening to Habitual Excellence by Value Capture. We hope you'll subscribe to the podcast. Please also rate and review it in your favorite podcast app. To learn more about Value Capture and how we can help your organization on a journey to habitual excellence, visit our website at www.valuecapturellc.com.